Senator Carper.
Mr. Chairman, to our ranking member, thanks for pulling us together today. And Mr. Witty, thank you for taking the time to talk with me earlier this week and for your testimony today. Among the things that I shared with you are some of the principles that guide me in my life in this role and in other roles I've been privileged to serve. But one of my guiding principles is everything I do, I know I can do better. And I think everything I do, I know I can do better. And I think that's true for all of us. I'm striving toward perfection. We know we're not going to get there, but at least that's our goal. Another one of my guiding principles is to treat other people the way I want to be treated. Golden rule. And I try to put myself in other people's shoes, whether you happen to be a constituent, whether you happen to be a patient, whether you happen to be a practitioner or a provider, put myself in their shoes and let that help guide me. The other thing I mentioned to you yesterday is this is a shared responsibility, the idea of shared responsibility. It's clearly obligations that you and your colleagues have, but there's a role for government, and there's a role for others to play. But there's a shared responsibility. One of the things I mentioned yesterday, I quoted Abraham Lincoln, he was asked, what is the role of government? And he said the role of government is to do for the people what they cannot do for themselves. And there's state government, county, local government, and we have federal government. So there's probably a role for all of us to play. We're proud in Delaware. We have about 1 million people in Delaware. We're about 100 miles from north to south, 50 miles from east to west. I cover my state like a glove every week, just about every week. And it's something I love to do, and it's easy to do. But we've heard from constituents, families, people that have been not just disadvantaged, but really hurt, really potentially put in harm's way. We heard from practitioners and providers in a real way, in a human way, on the phone and in person. So for us, this is very real. But thinking aloud in terms of the role of government, since we are the government, federal government, role of government here, what might be one or two of the roles that we could play, should play?
Well, Senator Carper, thank you very much for the question and your comments. I think maybe two areas I would suggest. One is helping the healthcare system think through what the minimum standards, what the kind of the right level of system protection and redundancy is to try and guard against the impacts of future attacks. And then the second is to see what further can be done, what more can be done to reduce the attack velocity that is coming at the U.S. healthcare system from cyber criminals and other possible actors. So I would maybe suggest those two areas for a thought.
Good, thanks. This attack was, as I understand it, maybe the worst of its kind against our healthcare system and the people that depend on that system, but the ramifications remain widespread. It's clear that Change Healthcare was not prepared for this attack. I don't know if it's possible to actually be prepared, fully prepared for an attack of this nature. But you shared with me yesterday that the attacks are ongoing and they're becoming more frequent, and more the people that are doing these, launching these attacks aren't stupid, and they're not getting any dumber, unfortunately. But it's clear that Change Healthcare wasn't prepared for this attack. The lack of basic cybersecurity measures left our healthcare providers and their patients vulnerable to disruptions in care and sensitive data and personal information being stolen. And like my colleagues, I've heard from, as I said earlier, providers, we've heard from practitioners, we've heard from families, from individuals throughout our state who are directly impacted from this attack. One individual we talked to was unable to receive her insulin prescription for several days because of the significant pharmacy delays. And that's not acceptable for any of us. But Mr. Witty, why do you think it took so long for your systems to get back up and running? And why are many pharmacies still offline today?
Senator, again, thank you for the question. And I'm very sorry to hear the situation of the patient who was waiting for their insulin. We have tried to make clear that we would honor any prescriptions which were filled with the pharmacist uncertain of what the reimbursement status was, but perhaps that also emphasizes the challenges of communicating across such a wide group of providers. The speed of recovery of our systems was really determined by the way the attack encrypted large parts of the environment, and to ensure that the system, when it was brought back online, garnered the confidence of all other participants in the environment that it was safe to reconnect to. And remembering that Change Healthcare is a big connecting system, we really built the environment from scratch. So we did not resuscitate large parts of the old environment, which could have brought with it the risks and the suspicion of infection and would have led to, I think, people not being willing to reconnect at all. We spent a lot of time rebuilding from scratch and then having third-party organizations test, scan, penetrate it to make sure it was super robust before it came back. But unfortunately, that took time. And the consequence of the way the attack impacted the first system and then the commitment to bring back a better, clean system was the explanation.